Thank you very much indeed, Madam Deputy Speaker. And I'd like to make the statement following the publication of our report over the summer on e-cigarettes. And can I start by thanking the over 90 organisations and individuals who provided us with written evidence and the 25 individuals who gave oral evidence. I'd also like to thank my fellow committee members, several of whom are present in the chamber today, for their work on this inquiry. This is strictly an evidence-based report, and it would have not have been possible without the input of so many organisations and individuals submitting evidence. Madam Deputy Speaker, the bottom line is that we conducted this inquiry because smoking kills. Despite the great strides that we've made in recent years, smoking remains the primary cause of preventable illness and premature death, accounting for approximately 79,000 deaths a year in England. It's a dreadful death toll which causes untold misery for families and communities up and down the country. But we know that nearly 3 million people in the UK are using e-cigarettes as a tool to help them stop smoking. The government's tobacco control plan points out that, and I quote, in 2016 it was estimated that 2 million consumers in England had used these products and completely stopped smoking, and a further 470,000 were using them as an aid to stop smoking. Now, e-cigarettes have been in the UK market since 2007, and we wanted to examine the evidence. Now, it's important to be really clear here. Our report is aimed at those who are already smoking cigarettes and at the horror of lives being lost through smoking-related diseases. If I could focus on the evidence, there's a growing consensus that e-cigarettes are significantly less harmful for a smoker's health. This is not just our committee's view of the evidence that we've analysed. It's the view of Public Health England, which makes an estimate that they are 95% less harmful than smoking. It's also the view of NICE, the British Medical Association Cancer Research UK, the British Heart Foundation, the Cochrane Tobacco Addiction Review Group, the Royal Society for Public Health, the Royal College of Physicians in Edinburgh, and many, many more. The government itself has acknowledged that, and I quote, "The evidence is increasingly clear that e-cigarettes are significantly less harmful to health than smoking tobacco." And I want to just quote the evidence from Public Health England and the MHRA, the regulator. They said, and I quote, "Levels of carcinogenic chemicals are substantially lower in e-cigarettes aerosol compared to tobacco smoke. Biomarkers of carcinogen exposures, that is, chemicals detected in the blood or urine of users, are also substantially decreased in current e-cigarette only users compared to cigarette smokers, and decrease when smokers switch to e-cigarettes." Now, clarity of the message on this is really important. Some people urge a more cautious approach because we do not know everything about long-term risk. But we conclude, and I quote, "Any judgment of risk has to take account of the risk of not adopting e-cigarettes, that is, continuing to smoke conventional cigarettes, which are substantially more harmful. We know they kill. So there is a price to be paid in human lives through adopting a more cautious approach." Now, our report made a number of recommendations, and today I'm going to focus on three particular areas. The need, first of all, for ongoing research into e-cigarettes, the use of e-cigarettes in mental health facilities, and their use in public spaces. So I hope today I can also correct some of the inaccuracies in some of the media coverage of the committee's report. So first of all, our report is not the end point. More evidence is needed. That's why we concluded that the government should maintain its planned annual evidence review on e-cigarettes. We also say that the government should support a long-term research programme to be overseen by Public Health England and the Committee on Toxicity of Chemicals in Food, Consumer Products and the Environment to ensure that health-related evidence is not dependent solely on the tobacco industry or the manufacturers of e-cigarettes. Now, honourable members might not know that 40% of adults with mental ill health smoke, compared to just 16% of the general population. Smoking is also the single largest cause of premature mortality for those with mental ill health. We know that people with severe and enduring mental ill health die 15 to 20 years earlier than other people. Therefore, as the government warns, if we do not reduce smoking amongst this group, which remains, as I say, stubbornly high, and I quote, "we will have failed to reduce health inequalities." That's the government's view. We surveyed mental health trusts to inform our work in this area. I think what we found was rather shocking. A third of mental health trusts still ban e-cigarettes within their facilities. We also found that 3/4 of NHS trusts, these are health trusts who ought to be on top of the evidence, are mistakenly concerned about second-hand e-cigarette vapour, despite evidence that it presents negligible health risk. But progressive trusts like Nottinghamshire Healthcare NHS Foundation Trust uses e-cigarettes to help patients give up smoking, whilst encouraging them to engage with treatments. Now, we conclude that all patients in mental health units should have the benefit of this more enlightened thinking. NHS England must set a clear central NHS policy on e-cigarettes in mental health units, which establishes as a default allowing e-cigarette use by patients unless an NHS trust can show reasons for not doing so, which are demonstrably evidence-based. Now, let me now turn to the area of our report that created the biggest public debate, and that is treatment of e-cigarettes in public spaces. Despite some suggestions to the contrary, we did not recommend that e-cigarettes should be allowed in closed public spaces or on public transport. We call for a public debate on how these products are dealt with in our public spaces. The coverage of our report has certainly kick-started a discussion, a public discussion, and I really welcome that. We need such a debate because the evidence suggests that no public health rationale for treating e-cigarettes and conventional cigarettes as one and the same. There are, however, nuisance justifications for restricting their use in public, such as in enclosed spaces and on public transport. I personally would not support any proposal which permitted the use of e-cigarettes on public transport, specifically because of the fact that many people find the smell of many vapours unpleasant and intrusive. But that is quite different to restricting usage based on misplaced health concerns in all public spaces in exactly the same way as we treat smoking. Madam Deputy Speaker, it is the duty, surely, of policymakers to understand what the evidence says about the relative harms of e-cigarettes and conventional cigarettes, and to make policy based on that evidence in consultation with experts. We call for a shift to a more risk-proportionate regulatory environment where regulations, advertising rules and tax and duties reflect that evidence on the relative harms of various e-cigarettes and tobacco products that are available. We need to take action so that we can encourage current smokers, given the death toll of 79,000 people in England alone every year, to make the switch to e-cigarettes and to improve their health. The potential to save lives is clear. Thank you.
Bob Blackman.
Thank you, Madam Deputy Speaker, and I thank the Chair of the Committee for his report and his clarification of what the recommendations of the committee actually were. I declare an interest as the Chairman of the All-Party Parliamentary Group for Action on Smoking and Health, and I think the clear message to smokers is the safest way to restore your health is to give up smoking completely. But if an alternative as a route towards that, taking up e-cigarettes is clearly a better health outcome. Can I just urge him to clarify once again his committee's position on the use of e-cigarettes in enclosed public spaces, such as public houses, restaurants, not only the transport facilities and so on, because in many ways there are two aspects. There's the nuisance aspect of smelling vapour, which is often of particular sense, but also the aspect that many people will be trying to give up smoking, and therefore if they then in an enclosed space see people using e-cigarettes, that may induce their craving for cigarettes after they've actually given up smoking in the first place. And I think the clarification of that, I think, would be very important. I personally would oppose any relaxation on any enclosed spaces on the use of e-cigarettes.
Well, I thank the Honourable Member for that really helpful contribution. First of all, just on the case for shifting to and encouraging smokers, which is clearly a big concern of his, to shift to e-cigarettes. Can I also just quote Dr. Jamie Brown of UCL, who said, and I quote, "Any perceived risk associated with offering reassurance before we have the long-term data must be balanced against the risk associated with the opportunity cost of failing to inform millions of people who are currently smoking uniquely dangerous products that e-cigarettes are safer when they believe wrongly that they are not." So I think that's a really important public health message to get across. I think with regard to public spaces, what we wanted to make very clear was to distinguish between public health justification for policies and the nuisance issue. It's very clear that the evidence says that secondary vaping, taking into your lungs vaping through close proximity of people vaping, carries nothing like the same risk as secondary smoking, which we know carries a very serious risk and led to the legislation passed in this House to ban smoking in public areas. But there is a good justification, which I totally accept, for not allowing vaping because of nuisance, because people find it invasive. I personally dislike the sort of sweet strawberry flavours and so on that you're often confronted by in close quarters. What I think was frustrating was that some of the graphics used, including by the BBC, showed people vaping on public transport, and yet we weren't making that recommendation. We were just saying, let's have a public discussion informed by the evidence and then reach our conclusions. And we shouldn't just automatically treat vaping in exactly the same way as what that academic described as uniquely dangerous activity of smoking tobacco.
Chris Elmore.
Speaker, can I welcome the Honourable Gentleman's Committee's report. He will obviously be aware that health is a devolved function in Wales, and it is not for this House or for any member of this House to suggest what policies should be implemented in Scotland or in Wales. But I think it is quite important, and would he agree with me, that when select committees of this House conduct these sorts of inquiries, that information can be shared with the devolved administrations so that they can take part in a wider debate around these issues. Because he may be aware that at the end of the last Assembly term there was a bill to try and ban e-cigarettes in Wales. It was lost for various other reasons, but nevertheless it wasn't passed on one of the last days of the Assembly sitting. Nevertheless, with this new information that's coming out and with the new evidence that's coming forward, would he agree with me that it is proper that select committees of this House do shared working around public health issues and indeed pass on evidence where they think it is of worth for UK-wide issues, because smoking is not just reserved to England or any of the other nations of the UK?
Well, I thank the Honourable Member for that very helpful contribution, and I totally agree with him. I will make sure that we specifically send the report to the devolved administrations. But I think he really highlights the fact that there is now such a strong consensus through all of the organisations that I referred to, Cancer Research UK, British Heart Foundation and so on, of the relative harm reduction through e-cigarettes compared to smoking. And any confusion of that message will result in fewer people giving up smoking and will result in more people in our country dying, and we must stop that.
Colin.
I was staggered to read in the Honourable Gentleman's report that NHS England doesn't have a dedicated person responsible for implementing the government's tobacco control plan, failed to provide a representative to the committee, and that there's no one in NHS England who's in charge of oversight of e-cigarette policies amongst NHS mental health trusts. Given that e-cigarettes, according to Public Health England, are 95% less harmful, and that early morbidity for mental health patients can take 15 to 20 years off their lives, isn't this a shocking state of affairs which NHS England needs to address urgently?
Well, I thank him for that question. I do agree. I thought it was extraordinary that NHS England were unable or unwilling to provide a witness for our inquiry. And I think there's a sort of sense that it's almost subcontracting its responsibility for this to Public Health England. Public Health England obviously have a very clear interest, but given the awful death toll that we've talked about, and in particular the fact that smoking prevalence amongst those with mental ill health remains stubbornly high at over 40%, NHS England, responsible for NHS trusts across the country, should and must take central responsibility for this and should appoint someone with responsibility for driving through this policy.
I'm Deputy Speaker, and it's some of the evidence we had during the committee hearings was talking about e-cigarette users having to go out and use smoking shelters outside buildings. And I think one of the witnesses likened this to an alcoholic being put into a pub situation and expected to refrain. Does he agree with me that public buildings, we need to have a more realistic view of the use of e-cigarettes within public buildings, perhaps a room or a dedicated area set aside so that e-cigarette users are not being forced to come face to face with the thing they're trying to give up?
Well, I thank my fellow committee member for that really helpful contribution. I think in that way she describes exactly what we should be discussing, and it addresses also the points made by the honourable member opposite. To simply send vapours to the cigarette shelter outside is completely counterproductive and makes it harder for people to give up. And so a room in a building may well be an appropriate step for many organisations to take, given that there is no health risk associated with vaping that there is with secondary smoking. So I thank her for that.
Ford.
Thank you, Madam Deputy Speaker, and it was most interesting to sit on the committee during this investigation. Can the Chairman of the committee confirm that it was not the intention of this report to suggest that e-cigarettes were zero risk, because they are new products and the long-term risks are not yet known? The only zero risk option is not to smoke.
Absolutely.
The honourable member is absolutely right. This is about harm reduction. And it's in a sense encapsulated in the position that Public Health England take, that they say as an estimate 95% less harmful. They are not saying there is no risk. And the very clear message to smokers is, if you can give up completely, that's the best step to take for your health. If you can't, then this reduces harm and ought to be followed.
Thank you, Madam Deputy Speaker, and it's that point which I want to take up. But first of all, could I commend the committee for doing this report? I think it will help a lot with public health across the UK. I note in the report that it says a medically licensed e-cigarette could assist smoking cessation efforts by making it easier for medical professionals to recommend them as a stop smoking treatment for patients. I think that's really good. Does he know if what the government's doing to encourage e-cigarette manufacturers to put forward product for licensing?
Well, I thank the honourable member for highlighting that particular recommendation, and I don't think there's anything in particular being done by the government to encourage organisations that I'm aware of to seek medical licensing. But I think the potential prize here is that if there was a medically licensed product, it would reach a proportion of current smokers who would be reassured that the medical license, in a sense, guaranteed that it would be a sensible step for them to take and a helpful one in giving up smoking.
Stephen Metcalfe.
Thank you, Madam Deputy Speaker, and apologies that I missed the very first hint of what the chairman of the committee was saying. It was a very interesting inquiry, and it was as controversial, I think, as we thought it might be when we selected it. The evidence we received was overwhelming that it is 95% safer, at least, to take up vaping and to stop smoking. Could the chairman speculate on why it is still that some persist in trying to put smoking and vaping side by side following the publication of the report? And with regards to the debate on smoking in public places, it is also the case that there is a range of devices, a range of flavours. Perhaps this will stimulate a debate that leads the industry to find devices that do not infringe on other people's airspace, so that they can expand the opportunities for people not to have to associate with smokers when they're vaping.
Well, I pay tribute to the honourable member for his work in initiating this in the previous committee and for his work as part of this inquiry as well. On that final point, vaping without some of the offensive flavours or flavours that some people find offensive is certainly helpful in encouraging people to be tolerant of vaping. And I think the great value of this report is to sort of reinforce those public health messages and to encourage people to understand the relative harm of e-cigarettes as against smoking. On the first point he makes, it is interesting that in the States and Australia and some other countries, they appear to take a different approach, and it appears to be based on sort of doing nothing until we have all of the evidence. But as the evidence that I quoted made clear, there is a price to be paid for that caution. And the price is that we're not getting a clear message based on evidence to smokers that shifting to e-cigarettes will save lives here and now. And so I think this country is leading the way. And with this very strong consensus, coalition of support around this clear evidence. And I think the great value of this report is to reinforce that message to people. It's in your interest. If you can't give up smoking altogether, shift to e-cigarettes because it will help save your life.
Thank you, Madam Deputy Speaker. I welcomed the amount of public engagement received off the back of the publication of this report, which I think showed a desire by the public to understand the evidence into what is a relatively new product with many misconceptions. But one of the key pieces of feedback that I received from many of my constituents was, I fear, off the back of some misreporting, that our Select Committee report was recommending vaping on buses. So for absolute clarity for this House and my constituents and the public, could the Chairman just be clear with everybody that we were not recommending that vaping should be allowed on buses?
The expression is read my lips. We were not recommending vaping on buses. I hope that's helpful.
Thank you.